Now let's hear from the other side. We have Representative Joe Sestak, a Democrat of Pennsylvania, saying that he ran for Congress primarily for one issue, and that issue was health care. For the most part, he agrees with the president's plan. Representative, let me get right to what Representative Cassidy just said. Nobody's approached him. He's a surgeon. Why wouldn't you and the Democrats at least try and include him into the fold to get his ideas as well? Is that an option?
I would like to think it is an option. Our president said that everyone should be around the table. I have to admit at times with the Hatfields and the McCoys, the Republicans and the Democrats down there, I think that's a major issue. But let me get to the central point that you also asked him. The patient should be at the center. My daughter, when I was in the military, was struck with a malignant brain tumor. I lived in Children's Hospital with her, 3 brain operations, chemo, and radiation. It's why I did get in. But sitting in the bed next to her was a 2.5-year-old young boy diagnosed with acute leukemia as she was going through her chemo. He did not have, or his parents didn't have, health insurance. The president put him right at the center when he said right off, every American will be covered. Now the issue is how to do it. Because you know, Liz, you yourself are paying for the uninsured. If you're single or you're a family with 2 children, you pay $1,100 more to cover the uninsured. President Obama merely is saying, bring them into the system, cover everyone, because if the uninsured are covered and you get early diagnosis, we'll have savings. And you'll pay one way or the other, but let's pay by a way that we can have greater savings in the end.
And you have said, Representative, that inaction is simply not an option. Finally, we have some action. It can't possibly surprise you, though, that there are people now immediately lobbing arrows at everything that the president is putting forth. But what kind of thing would really get the total approval? And I'm thinking at some point we've got to have assurances that the quality of care, and that's something, for example, that Ken Langone, the co-founder of Home Depot, was saying he was worried about was perhaps the rationing of care like we see in Canada, that wouldn't happen here in the United States.
Those are all good points. First off, is we know that we've tried doing nothing the last 8 years, and we added 7 million to the uninsured. And as those aren't paying premiums, yours and my premiums go up. And we can't keep that cycle going. There has to be, and we understand it, some give and take. Let's take, for example, the insurance companies. There's 47 Americans uninsured. They would like to have them in their plans. So therefore, we should mandate that they should be in their plans. Why? They get to cover them. It's good for business. But 1/5 of those 47 million Americans who are uninsured are actually the masters of the universe, the youth who don't want to pay that extra money, making more than $50,000 a year. If they're in the plan, then the health premium should go down because the healthy are sharing the risk. So those are the kinds of give and takes, and I have to agree with Bill. We should have Republicans, Democrats, the Hatfields and McCoys particularly, around that table.
Exactly.
Absolutely.
Let's bring you two back. We'll do it here on Fox Business. We're happy to take up that effort. So we'll have you both back together. Thank you so much, Representative Sestak.
Thanks for having me, Liz.
Representative Sestak is a Democrat of Pennsylvania. It's so great to see you once again. Thank you for coming on Fox Business. Closing bell ring.